College of Optometry and the University of Chicago entered into an academic affiliation in 1997. Charlie was truly a visionary. There's no question about that. And he was way ahead of the curve when he was setting up these linkage and affiliation models in Boston, in Philadelphia, and then finally here in Chicago.
This relationship between MDs and ODs, we want to be at the forefront of developing that relationship. We don't want both sides to develop the relationship on their own, but rather we want it to be developed collaboratively. I mean, the number of diseases, the number of therapies we have has grown exponentially. And with that, the relationship has grown, this co-management of our patients, once again, with everyone practicing at the highest level of their training. That's what it's all about, to benefit the patient.
Patient-centered care is student-centered care. The clinical training program, the educational process, everything falls into place if we put the patients first and understand that it's a very, very solemn trust.
The treatment paradigms have evolved tremendously over the past 18 years I've been in practice. And along with that, retina specialists are learning, the ophthalmology community is learning. And at the end, with this close collaboration, with this teamwork, that the patient benefits at so many levels.
We run very busy clinics here, and I think part of that learning experience is the active and passive learning that goes on within that environment. It's not just a matter of learning what the journals or the protocols are telling you is the best way to treat a certain disease process, but then of course to go along with that, getting the insight from, for instance, a world-renowned vitreoretinal surgeon such as Dr. Hariprasad.
It's the highlight of my week, coming and to this wonderful facility. So first and foremost, I enjoy coming here, and I enjoy the people, I enjoy the relationships, and the energy, the life, the interest the students have in learning.
Dr. Hariprasad, Sinu, my good friend, we've known each other for 20 years. He is just such a very, very dear friend. He's somewhat like the brother I never had.
It's a lifelong friendship, and I really credit him for the vibrancy, the energy, the excitement of this relationship between the University of Chicago and the Illinois Eye Institute. He's the life of this relationship, and the Mullen of our generation. That's how I think I would best put it.
Of course, I am biased, but we have a wonderful program. We have a very unique program. We're training our optometry students, our residents, to be the best possible providers that they can be.
I mean, both institutions, the trainees are of utmost importance to us. They're our legacy, they're our future. And I think from Mullen's days, Terry Ernest's days, I think that was also in focus.
I think that it warms his heart to see the evolution, not only philosophically of what we're achieving, but physically, the way this particular partnership has blossomed.
Dr. Mullen and Terry Ernest, they both would be very proud if they saw where this relationship would be 3 decades later. I certainly am. It'll continue for decades to come, God willing, and we really hope that the beneficiaries are our patients.